not about it's really not about conforming or looking good. Patients, girls, teenagers who have large noses with bumps, who are very happy with their external body image, are very content, the inside matches the outside. They don't come into my office. They're not having surgery. It's those patients that are not happy with the outside, who want to, the wished-for body doesn't match what they really do look like. Those are the ones that should have surgery as teenagers, because body image and self-esteem are so intertwined with external appearance that if the change is made at a time when when the unwanted appearance is harming their lives, it's very, very important to make the change at that time.
The difference between having a change in a hair color and having your nose
Does that mean every patient with acne, full-blown acne, shouldn't take antibiotics that can kill you, shouldn't take any medication, should just let the acne sit there for months and years and cause, cradle-like scarring? Should you just accept this disease process, which will create scarring and deformity because God gave you acne?
Process, you don't have to change.
It's the same exact thing.
This
is
is under the microscope, like that girl with the liposuction.
And because my father was supportive too, he said he felt that a young woman should feel good about herself. It would give confidence. It would make them able to deal with a world out there and not have to worry about incidental small things that might be bothering them.
By the way, the girls who want this surgery, who desperately want their noses done, who are not allowed to do so because of monetary issues, parents who don't support and approve them, these girls become very reclusive. They can't do the surgery, so they forget about it. They move on to the next thing. However, they act out in other ways. I noticed that these girls tend to overeat. These are the kind of girls that go out with marginal boys, who get tattoos, who pick at their faces, who just ignore their nose, and ignore their chins, and they become destructive. They become very destructive.
Well,
go ahead.
That's not necessarily
For the doctor in the middle, if you have a girl that's 12 or 13 years old, whether she wants to have her nose fixed or her chin, whatever, how often do you meet with her in your office? Do you just say, yes, let's book an appointment, it's going to cost you so much money? And
no, I knew this girl her mother had her nose done in 1978. And I knew that girl since she was 4 months old. So her mother was my first rhinoplasty in 1978. And I became friendly with her. We maintained the friendship for years. So I knew this girl she was growing up, and I knew her, and her nose was quite tragic, actually. And it was an obstacle for her.
I don't personally think you should judge those types of girls in that way. Like, it's just inappropriate. Like, how can you say that a person with something wrong with their nose is going to go ahead and overeat or do something like that?
Well, not in every case. We're talking about a bell curve of normalcy. There's variations there's abnormalities on both sides. But many people react abnormally when they, are unhappy about a body part, when the inner body doesn't match the external, the inner body, the wished-for body doesn't match what they really look like, and they can't do something about it. That frustration level, that depression sets in, and many people react abnormally. I have one patient who had a very large nose. Her sister had a large nose, and the family was totally against plastic surgery. For decades, she went for psychoanalysis 5 days a week, for years. Finally, she went to a very good psychiatrist who said, maybe you should separate from this barrier that your mother set up and do your nose. And she said, I will do that. And she did, and the report back about how she's progressed with her psychotherapy is that she's probably saved 5 years' worth of treatment, that she's overcome this barrier, she did what she always wanted to do, and she's now happy. How about the 54-year-old lady who comes to my office for a facelift, eyelid, neck job? She's 54, everybody wants to look younger, everybody wants to look better. That's an acceptable procedure. And we talk about the operation. The nose is about this big. I never mention it because that's not what they came in for. I would never mention it. So I'm ready to book the facelift, book the eyelid operation. I'm almost ready to leave the room, and the patient says, well, what do you think about my nose? I said, well, what do you think about it? So you're 54, you've had this nose for some time. Well, I've always wanted to do it. That desire permeates, it lasts for decades. People never lose interest in changing a body part. And maybe at the time she was 18 or 17,
So you're saying, Dr. Lipkin, if you're hung up about your nose when you're 17, you're going to be hung up about it when you're 60 or
Not
50?
in the same way. By the time you're 54 and you have your nose changed, the impact of the improvement is not the same.
Do you agree with that? That if you're hung up about it when you're a teenager, you're going to be hung up about it when you're... No? All right, stay tuned. More about cosmetic surgery for teens when we come back in just a moment.